Probably a couple of months ago, when there was the explosion of the pandemic in Europe, and this initial phase of the lockdown and initial awareness of how, for example, NHS, medical and staff of the National Health Service here in UK, but before in Italy, before in China, were affected also psychologically, and so how communities responded in a very compassionate, empathic ways with where they were demonstrating their gratitude and their support for all these workers. And it occurred to me that what can we do, what else can we do, and who else actually is involved in so directly and may benefit from different ways to be recognized and be supported psychologically. And because of the nature of our course and the nature of what we do, including our students do, I guess in discussion altogether, we came out with the idea of offering and opening on the website of UEL a portal that was a wellbeing portal that was specifically dedicated to healthcare practitioners and humanitarian professionals who are currently working in directly in tackling COVID-19, and find a different number of possible resources that could support them from psychologically, emotionally, so from mental health point of view, but in a variety of ways. And I would like really to acknowledge what in our discussions with students often came up, because our students are international and they work in international contexts, in a way that is inclusive, so in a way that also acknowledge different cultures, and so possibly offering resources that can be in different languages and can really be accessible to different layers of workers that often are maybe not even acknowledged, but they are actually working directly to save other people's lives, and who would benefit from a place where they can find information, but also resources to really support themselves, to support their self-care and to support their resilience in this moment.
I think also part of the project, as we have been talking with students, but between you and I, is also to provide a space where, like you said, a space for resources, but it's something about it that's educational as well. So they also can learn not just for themselves about the psychological aspects and the impact that it has on them, but the impact that it has on those they are directly working with in some ways, or maybe supporting in some ways. So they have this bit of extra knowledge that they can use when they're doing their jobs as well.
Exactly. So in this sense, I guess, again, in discussion with our students, we thought that what we study, what we do, what we practice can in this moment be particularly relevant to hopefully a number of people out there, and so that we could actually use all these knowledge exchange that we try to cultivate within our little program outside as well.
Yeah.
To use a number of resources, so from reading materials to video clips recorded by us, by the students, by external guests that we can invite on different topics related to mental health and self-care and resilience, and including, maybe resources to access meditation or mindfulness or yoga or physical exercise, or things that can help different ways to support oneself, but also we were thinking to offer live webinars where we can cover specific topics and in forms of basically live sort of event where people can access and ask questions and interact with us, and live workshops that can be intense workshops of a day or even longer, where we cover topics like resilience or working creatively to engage with one another in moments of crisis, and with again also external guests, and where people can attend like they would do on conferences. And we were also thinking to offer live reflective groups for practitioners, so either in a form of drop-in or in a form of weekly meetings with the same participants, so as closed groups. But spaces where, for example, practitioners can meet with each other and share their experience of their current situation, and giving and receiving support and ideas and exchange strategies, and maybe even find solutions to problems, and using that as a sort of sustainable system that can support people working in this context, managing their daily or weekly routine, and somehow networking with each other as a form of support. So these are probably part of, and even more. I mean, the idea is once we open it, that is open now, and then we start to implement and populate the portal with these resources that I mentioned, but many more hopefully will come, and hopefully it will be a portal that will remain alive also, hopefully soon when COVID-19 will be over. But